A patient comes with a history of severe bleeding and he may have a normal platelet count. So platelet number and platelet function are not the same thing, and a patient can bleed severely even with a normal platelet count. This is because the problem lies in the platelet function. The clinical trap is that CBC shows patient's platelet is normal, prothrombin time is normal, APTT is normal. But the patient has episodic epistaxis, history of hemorrhagia, easy bruisability, and torrential postdental bleeding. This is the context in which you should think of a platelet functional disorder, especially if it is an onset since childhood. The common cause is von Willebrand factor. This is the most common inherited bleeding disorder. Because von Willebrand factor is needed for platelet adhesion, platelet counts often stays normal. Drug-induced dysfunction is the second most common of platelet dysfunction. This is acquired and usually have in adults. Common drugs are aspirin, topical, and NSAIDs. These impair platelet aggregation. And next chronic medical condition is uremia. In renal failure, it causes qualitative platelet dysfunction. Classic cause of bleeding from the nose with a normal platelet count. So it's essentially a pattern recognition. Usually the platelet count is normal, PT-APTT is normal, and the bleeding type is usually mucocutaneous in platelet function disorders. So bleeding with a normal platelet count, think of platelet functional disorders.